everyone. So we are here today discussing the most common mistakes that the candidates make during the practical exam with respect to different tasks and stations, which leads to a substandard score or a fail in that particular station or task. Now, please remember before watching this video, before we discuss this particular file that we have here, please make sure that you have gone through the videos that we have for the assessment of different technical tasks in the portal, the communication OSCEs that we have, the solved version of the OSCEs, and the technical OSCEs that we have. Because over here, what we are discussing is the common mistakes that the candidates make. And these mistakes are made by competent candidates, prepared candidates, all right? So if you're new to the ADC practical exam journey, make sure that you know the basics first. Make sure that you know the marking rubrics for each technical task before you start watching this video or before you start analyzing your task. Because over here, what we have done is we have picked up mistakes from our experience assessing hundreds and hundreds of candidates, and we have pointed out those common mistakes. But that does not mean that there are not other mistakes that the candidates make. There are other mistakes as well. And of course, you need to stick to the marking rubrics with respect to each task. All right. But over here, what we have done is that we have picked up common mistakes that the candidates frequently or routinely make when we are assessing the candidate's work, which leads to a fail or a substandard score in a particular task or a station. All right. Let me remind you again that here we are pointing out common mistakes. It does not mean that there are not other mistakes that the candidates cannot make. There are many other mistakes which are mentioned in the marking rubrics. Whenever you do a particular task, OSCE, or a station, you have to fit yourself in all the marking rubrics. But here we are discussing the common mistakes, which at times the candidate is not aware that he's making or she's making, and they get a fail grade in the exam. They think that they performed the task pretty well, but there were mistakes that they were not aware of. And that's what we are discussing here. Because when we assess the candidate's work, they tell us they are satisfied with the work that they have done. But once we start assessing the task, we point out these mistakes, which are quite significant mistakes and can lead to a very bad score or a substandard score or a failed task in that particular task that they are showing us and the one that we are assessing. All right. So before we discuss how the tasks are assessed and how the common mistakes are done, I would like to discuss the marking system, how ADC follows a marking system, what assessment system is being followed for each technical task, technical OSCE station or a communication OSCE station. Now you see a candidate can receive one of four possible grades for each checklist criteria. What are the checklist criteria? Those are the criteria which are mentioned in the marking rubrics, all right? There are 15 criteria for each task or station that you have in the exam. And you are marked on the checklist, very good, satisfactory, borderline, unsatisfactory. Each grade relates to a numerical score of 3210. A candidate can therefore receive a minimum score of 0 and a maximum score of 45 for an individual OSCE station, all right? So you are being marked on a checklist, and the checklist has 15 points. If you perform very good in all the 15 checklist points, you will get a maximum score of 45 out of 45. If you perform poorly in all the checklist points, which is unsatisfactory, you will get 0 out of 45. All right. Now, depending upon which checklist point you have done very good in, where you have performed satisfactorily, where you have performed as a borderline, or where you have performed unsatisfactory, your score will be calculated and you will get a score out of 45. All right. So this is how ADC marks each task based on the checklist that they have. And they have the checklist in the practical exam handbook. They follow that checklist and they mark you for each checklist point. You can get either a 3 score, 2 score, 1 score, or 0 score in each checklist point. And at the end, all the scores that you have got for each checklist point are calculated and you get a score out of 45. So this is one way where you are assessed based on the checklist criteria. The second way that you are assessed is the examiner also gives each candidate an overall score for that task called a global rating. All right. Now, what is a global rating? This is an examiner's point of view with respect to the task that you have performed. It does not follow any checklist. The checklist is followed in the first part of the assessment. In the second part, it's the examiner point of view with respect to the task that you have performed with respect to the communication OSCE or a technical OSCE or a technical task. All right. A candidate can receive one of 5 global rating grades for their overall task performance: outstanding, pass, borderline, fail, or bad fail. Each global rating grade relates to a numerical score of 4, 3, 2, 1, or 0, respectively. So the examiner can give you a global rating with respect to the task or a station, which will be based on 5 categories: either an outstanding, pass, borderline, fail, or bad fail. Now, for this global rating, you do not have any checklist. The checklist scoring has already been done for each task. This is a global rating, which is basically the examiner's point of view or examiner's opinions on the task that you have done, on the performance that you have done in each technical OSCE and a communication OSCE. All right. This is very important because these two correlate whether you are going to pass a particular station or an OSCE, or you're going to fail a particular station or OSCE, because a graph is plotted, all right? And both your checklist score and your global rating score are documented, and then you either receive a pass or a fail in a particular station, all right? So that is very, very important because candidates usually neglect the global rating. This is basically something that the examiner is going to give you for each task. And this is something very important because you might perform very well. Let's say you have performed an amalgam restoration. Just giving you an example. You don't have a distal contact at all right, let's say. But because the checklist points out each individual criteria or each individual point, so you might score bad in the contact point, but you might score well in the other 14 points of the checklist, because there are 15 points in the checklist. Contact is one of them, right? So you might not score good, or you might score 0, unsatisfactory, in that particular contact point. All right, but you might score well in the other 14 checklist points that they have for each task. So you might, let's say, get 38 out of 45, let's say, okay, in this amalgam restoration that you have done, which doesn't have a distal contact. But the thing is that you still get 38 out of 45, which seems to be a very good score, isn't it? And definitely a pass. But the problem comes here is the global rating, which is the examiner point of view. And the examiner thinks practically, all right? They think clinically. So let's say the examiner sees that you do not have distal contact, and you know the significance of contact in a restoration. It leads to food impaction, gum problems, pain, swelling for the patient, right? Because contact is important. So the examiner might give you somewhere between borderline and fail, or maybe even a bad fail if it's a strict examiner. So although you scored 38 out of 45, let's say in the checklist, in the global rating, you scored borderline fail or bad fail because you didn't have a distal contact. So there is a good chance that despite scoring well in the checklist, you still will fail the task because of the global rating or the examiner's point of view. You understand? So that's how it is functioned. Candidates still don't understand this. They have mentioned in the ADC assessment process multiple times that your task is assessed on a checklist and a global rating. And the global rating is important because if you make major mistakes, you will be marked down in the global rating, which will affect your overall pass or fail in that particular station or technical task, irrespective of how well you have done in the checklist score. All right. I hope this is clear. Just to summarize, you are marked on a checklist out of 45, and the checklist points are mentioned in the ADC practical exam handbook. There are 15 points for each task, and you're given a score out of 45 for the checklist score. And then for the global rating, which is the examiner point of view, you get 5 categories: outstanding, pass, borderline, fail, or bad fail. And you get a score of 4, 3, 2, 1, or 0. All right. So then a graph is plotted for the checklist and the global rating, and then your performance is just whether you're able to pass that particular station or task or fail it. All right. Now, what we are going to do is we are going to point out common mistakes that the candidates make with respect to different technical tasks. First, that's what we are going to do, and then we'll discuss the technical OSCEs and the communication OSCEs. All right. Now, with respect to complex amalgam restoration, of course, this is a task that takes a lot of time to achieve perfection. All right. You definitely need to satisfy all the requirements which are there in the checklist of this task in the practical exam handbook. But the common mistakes that we see the candidates making is that there is debris present on the model or on the tooth. This is an easiest thing that you can avoid, but we still see a lot of candidates doing the same thing again and again. If you look at this particular candidate's task, he has done pretty well, I would say, not bad. But if you look here, this is unnecessary debris, all right, which will unnecessarily pull down your score. So this is something that you can easily avoid. Make sure once you're done with the task, you have alcohol swabs given to you in the exam. Rub the alcohol swab on the entire tooth, on the gum area next to the tooth, and wash the entire jaw because amalgam tends to spread here and there. So make sure you have nothing of the model or the tooth. And this is the easiest thing that you can do. It's not something technique sensitive. It's pretty straightforward. Just make sure the task is clean, your tooth is clean, it doesn't have any amalgam debris. Junction of restoration and tooth not detectable by probe. Now, again, one of the major mistakes that the candidates make. They make a beautiful restoration, all right? But the junction where the restoration meets the tooth, there is a gap, there is a void, or there is a deficiency. So when you move the probe sticks. Now, again, let me tell you, the problem is that when the examiner sees such a task, you know, if you have a gap, it is something that makes you more prone to decay. Food impaction can happen, resulting in recurrent caries. All right. So again, make sure when you're done with the task, there are no gaps present between the tooth restorative junction. A very, very important point. All right. And it has to be throughout the restoration, not only on the occlusal surface, on the below the cusp which you're building with amalgam, you have a tooth restorative junction. In the line angles where the contact is being built, you have the tooth restorative junction. So anywhere you have a tooth restorative junction, you need to make sure that the probe flows smoothly without getting stuck. All right. Proximal contact contour. Now, the problem here is that the candidates are so busy in making sure that the contact is good, which is of course important, but they forget about proximal contact contour, which is also a checklist point. Now, what does proximal contact contour mean? Now, if you see here, this candidate, if you look at the proximal contact, you see the contact is there definitely, but the contour is very poor. All right, it could have been something like this. All right. You see, if this part, this is all axis, which is not required. So you can have a contact contour, which is this way, rather than this way, which is wide and also something that doesn't give you a good score for the proximal contact contour. All right. Now, the other thing is the marginal ridge at same height as adjacent marginal ridge. Now, you have this point only in the amalgam restoration in the practical exam marking rubric. You do not have this point for the composite and the provisional restoration. Now, marginal ridge at same height as adjacent marginal ridge is very, very important. If your marginal ridge is above or lower than the adjacent marginal ridge, you are going to be marked down. And it happens very, very easily. We see a lot of candidates making the same mistakes again and again. So make sure that your marginal ridge is the same level as the adjacent marginal ridge, not higher, not lower. And you can easily do this while you're carving your amalgam restoration. Now, the reason why I say these all points are important is because The candidates, when they perform this task, they think they have done well. When they get the results from ADC, they get a fail in this particular task or any task in fact. So the reason why ADC fails you in a particular task is not because they want to fail you, because you are not satisfied what is expected out of that task. And you easily miss these little points. And we have seen them. We have seen candidates missing them again and again and again. And we have noted down these 4 points as one of the main reasons why good candidates with good restorations fail the task as well. All right. Coming on to the composite preparation task. Now, one point that I would like to discuss is that do not leave this task as your last task of the day. The reason why I say is that because this task requires patience. If you're doing it as a last task or the second last task of your day, you're going to rush. And when you rush with this task, errors are bound to happen. Remember that. Try to do that in the first half of the exam as the first or the second task, in fact, because I don't want candidates to rush while doing this task. Because when you are going to rush, you are going to be stressed. And when you are stressed, you are going to perform poorly. You're going to make mistakes that you know you should not be making. All right. Now, coming on to the most important point that we see with candidates is damage to adjacent or assessment to beyond preparation. One of the most common reasons. ADC does provide you with the wedge guards, the fender wedges. When you are doing the proximal box preparation, make sure to use them. All right, very, very important and a very easy criteria point that you can avoid. All right. Now, I'll show you an example here. If you look at this kind of task, it looks good, nice, little bit extension over the occlusal area, but probably a pass. No unsupported enamel, box is good, gingival clearance is there. But if you look here, these two indentation that this candidate has made on the adjacent tooth, this is going to mark him significantly down, possibly a fail. Because like I said again, with the checklist, you might score well because everything else seems nice and fine. But with the global rating, with the examiner's point of view, if you have such a big ditch and grooves or indentations on the adjacent tooth, this is something that requires restoration now, because this is going to be an area of food impactions, recurrent decay, gum problems, and this is something that is not acceptable. So when the examiner assesses you on the checklist, you might get something good score, all right, because this candidate has done pretty well with respect to all the other categories. But because when the examiner is going to give you a global rating, you are going to be marked down, which can possibly lead to a borderline or a fail, in fact. Depends on how strict the examiner is and how important he considers these indentations or grooves or damage that you have made to the adjacent tooth. All right. Buccolingual width box. Now, some candidates have the habit when they create the buccolingual width, they extend it to gain clearance from the adjacent tooth. That is not required according to the ADC marking criteria. So please don't do it. Okay. Gingival flow clears contact completely. This is a criteria of the checklist. We see candidate here, he has cleared the contact completely, which is very nice. Some candidates clear it partially, and partial portion of the gingival floor is in contact with the adjacent tooth. So again, making your life harder, pulling your down your checklist scoring. So make sure that your gingival floor clears the contact completely, like in this case. All right. Other significant points in this particular task is overextension. All right. Not removing the decay completely. Certain areas, the decay is left. So we have an assessment video for the caries task. Make sure to watch this. But this is something that we have pointed out in good candidates doing good the task in a better or a good way and still making mistakes, which leads to a fail. All right. And this is one task, to tell you very frankly, a lot of candidates think they did well. And when the results come out, they fail the task because of these little errors, which you think you didn't make. But when the examiner assesses it, you have made them. and the examiner has to be fair and square with all candidates. So they will fail you for reasons as small as this. All right. Endodontic axis cavity. Again, something very significant, very important task. The three main mistakes that we have noted here is pulpal horns adequately removed. Candidates do not remove the pulpal horns completely. Complete removal of pulp chamber roof. Again, the candidates do not remove the pulp chamber roof. Straight line canal axis. Again, the straight line canal axis is not achieved. Now I'll tell you basically how it is. This is the roof of the pulp chamber, right? This is the area between the canal orifices, all right? The roof is present between the canal orifices. The horns are present above the canal orifices, all right? Because some candidates still don't know about this. The roof is something between the canal orifices, all right? And the horns are above the canal orifices. The pulpal horns are located above the canal orifices, all right? So the candidates don't remove the pulpal horns completely. They don't remove the pulp chamber roof. And straight line axis is not achieved because their preparation is very small or narrow. They try to be so conservative that they forget that they need to achieve a straight line axis. Because the problem here is that, again, I'm mentioning in the checklist category, you might score well. But the problem is when you're getting a global rating, which is the examiner's point of view, examiner knows that this tooth is being prepared to perform a root canal treatment. So if you have a tooth which is so narrow, which is not something that is comfortable for a practitioner to perform a root canal treatment, he is going to mark you down, all right? And this is two pictures that I've captured just to show you how it should be. If you look, this is the mesobuccal canal, and this is the area above the mesobuccal canal. It should be smooth, straight. When you have a pulpal horn remaining, you will have an indentation or a stop here when you use the probe and you pull it here in the occlusal direction, you will feel a stop here. That's where the pulpal horn has not been removed completely. In this particular picture, it has been removed completely, which is nice and smooth. The pulpal canal, pulpal horn, which is left. Now, this is the palatal canal, and if you look, it should be smooth and straight like this. In most cases, we see there is an indentation or a pulpal horn or part of the roof left here somewhere. And when you use the endo probe and you pull it from the cavity to the occlusal direction, you see a stop or your probe getting stopped here. This is where the horn or somewhere here, if it is, the roof is left behind, which needs to be removed. So it should be straight like this. Or in this particular picture, the candidate does not have any horn remaining. We have the assessment videos of endodontic tasks. Please make sure to watch it again and again so that you know the other categories with other criteria for this particular task as well. Now, the other thing that we have here is the metallic ceramic crown preparation. Now, this is one task that takes a lot of time, all right, during the exam as well, and while you're preparing for the exam, because it takes a lot of time, energy to master yourself, to master the checklist points. Common mistakes that we see here is margin is 0.5 mm supragingival. This is the category or the criteria of ADC. We see candidates moving subgingivally in the proximal areas very often, all right? Now, in order to avoid that, make sure to keep the margin up and then gradually take it down. While you're preparing the task, initially keep it above, at least 1 mm above the gum level. So that when you're finishing the task, you need any further reductions, you can make it comfortably without going subgingival, all right? Damage to adjacent or assessment tooth beyond preparation. Again, one of the most common reasons we see for very good preparations, but the adjacent tooth has been nicked or damaged. While you are preparing the proximal areas, try to use the frontal guards, the fender wedges that the ADC provides you in order to protect the adjacent tooth. A simple step that can avoid getting dragged down in the checklist points and the global rating. Undercuts, again, very common. I'll show you in which areas we see it as the most often. Overall preparation taper, again, very common. especially the proximal areas. We see in the lower molars, the distal has been over-tapered and the mesial is straight without any taper. So try to avoid something like that. Now, this is one of the crown preparation that we candidates did. Now, if you look overall, it looks nice and fine. Everything is nice and smooth. But there was an undercut in the distolingual area. The margin in the distolingual area was not 0.5 mm, which will make the candidate lose score with the marking rubrics. All right. He might not fail the task entirely, but he'll not get a very good score. So if he performs bad in the other task, he will not be compensated and he might fail the cluster as a whole. All right. So this part we see the margin is usually not sufficient. The tooth structure has not been sufficiently reduced, and there's an undercut in the distolingual area. A very, very common phenomenon that we see almost 6 out of 10 preparations that we assess. All right. Now, the other important thing, which I think most of the candidates are not aware about, when they are doing the canine preparation or the incisor preparation, the area below the cingulum should follow the same anatomical contour of the original tooth before the preparation was done. We see candidates preparing this part in an overly tapered way. It's like this, you see? It's like this. Over here, it's fine in the picture, but when we assess the candidates, the area below the cingulum is too inclined, which is too over tapered, unnecessarily marking you down. Now, most of the candidates believe the taper is only in the proximals. No, the taper is overall preparation tapers, including the buccal and the lingual wall or the palatal wall. All right. So when you do the preparation of the cingulum, make sure that it follows the same anatomical contour of the tooth rather than inclining it too steep, which is an over preparation or over tapered. And again, you're being marked down. Undercut. Now, the undercuts we see very commonly in 3 locations. One is the distolingual area, all right, of the molars, the labial cervical half of the canine, and the labial cervical half of the incisor, all right. Most candidates we see, they have an undercut over here, okay. Again, something very easy to avoid. I've given you points and tips on how to assess undercuts in your preparation in the assessment videos. Make sure to follow that. Provisional crown restoration, again, something very significant, something that now with the provisional crown restoration, the common mistakes that we see now, this is one of the tasks that a lot of candidates fail. All right. And if we assess maybe 60, 70 tasks a week, we see 50 of them failing this task. All right. Because ADC is very strict with the provisional criteria and you need to practice this task. And this is a very unpredictable task. Sometimes it gets out fine and nice. Sometimes even if you practice a lot, it might not get as you would have expected. All right. So the common mistakes that we see is junction of restoration and tooth not detected by probe. This is ADC marking criteria. All right. But we see the candidates, there is a distinct deficiency or void at the margin, all right? And when we pass the probe sticks. Slight detection is fine, it still falls under satisfactory, but if you have a void or a deficiency, which is 0.5 mm, less than 0.5 mm, in fact, you automatically go into the borderline. And if it's more than that, you go to that unsatisfactory category. No overhangs present, usually seen in the proximal areas. The provisional crown material is beyond the tooth margin, which is an overhang, right? So we see this very common in the proximal areas of the molars and the upper canines and central incisors. No loose axis material present. Very commonly, we see candidates, well-performing candidates, leaving loose provisional material present on the adjacent tooth, present on the gums. It's such an easy category that you can avoid getting pulled down in the checklist criteria. You just need to make sure that there are no loose material present. All right, it's nothing technical or technique sensitive, like I mentioned earlier as well with the amalgam task. No incremental lines. Now, when you're finishing the provisional, you have the slow speed handpiece, right? The slow speed handpiece has 2 settings, whether you can use it with water or without water, okay? And then there are different speeds available as well. When you're using the handpiece, slow speed handpiece, try to use it in a sequence, all right? Which means that from the most coarse to the least coarse, all right? So there are 4 categories of the discs that are available to you. You don't need the first category, which is the most coarse, because that's too destructive. You can just use the second, third, and the fourth, and use it in a sequence. All right, and spend time smoothing up and polishing your provisional crown, because that's the category, that's the criteria checklist marking rubric. All right, and incremental lines are most commonly seen around the contact area, because that's where the most excess provisional crown material is, which you need to trim down. Proximal contact contour, again, a very important point, which is neglected by 90% of the candidates, that they don't care about the proximal contact contour. They care about the proximal contact. Of course, you have to care about the proximal contact, but you also need to care about proximal contact contour, because these are 2 separate points. Proximal contact is 1 point, proximal contact contour is 2nd point in the checklist. So you need to satisfy both, not one, in order to score well. Now, if you look here, this is how the provisional crown should look. All right. See, it is completely flushed with the structure, no overhangs, no distinct deficiency around the margins, no incremental lines present, quite smooth and nice and polished. And one other thing which is not mentioned here is that the restorative margins, this is something that the candidates, I think, don't even know, that your provisional crown margin should be smooth and distinct, not having any rough, irregular margins. As you can see here, it's smooth and nice. Most of the candidates don't even know this point. All right. So this is also a checklist category. So your provisional crown restorative margin, not the tooth crown margins, not the crown margin that you have prepared. The provisional crown margin should be smooth and distinct, which is mentioned in the marking rubric as well. If you look here, you see this is a deficiency in the proximal area. All right. And this will automatically lead to a borderline or unsatisfactory, because there is a deficiency or void, and it mentions in the checklist. Proximal contact contour. Now you see this is a lower molar, right? If you look, the proximal contact contour is very nice, smooth, how it is to be in the natural tooth. But if you look here, you see, this is something that I want the candidates to understand, that you don't have to prepare it this way. And if you look at this line here, it is even it's not even convex, it's concave now. So the proximal contact contour is very bad here. It probably falls under borderline or unsatisfactory. All right, the contact is there, that's fine. You might get a good score for the contact, but the proximal contact contour, first of all, this should be somewhere like this, just like you see here. But here, if you see, the proximal contact contour is not good, and the contact contour is concave. It's not convex anymore. It should be convex. All contacts that we have around our teeth are convex, not concave. And here, if you see, this is a concave contour, and you'll be marked down straight out. All right. So these little mistakes, the candidates think that they have done the task well, but if you examine it according to checklist, examine it according to the clinical implications of the problems that you make in your task, they are quite significant. So you might score well in the checklist, like I mentioned earlier. But when you're going for the global rating, you will be marked down, because this is something that the examiner doesn't want to see. Your contact should be something that should be how it is around the natural tooth, and this is how it is. These are 2 separate candidates. This one will get a good score overall, and they will get a good score in the proximal contact contour as well as proximal contact. But this candidate might get a good score in proximal contact, but will fail in the proximal contact contour section, which can or cannot fail the entire task, depending upon the other checklist points, how they are satisfied, and depending upon the global rating. All right. Resin composite restoration, again, something very significant, very easy to do, very easy to master, but the candidates still make mistakes. I'll tell you how. Junction of restoration and tooth not detectable by probe or slightly detected. That is accepted. Okay. When you're moving the probe from the tooth to the restoration, it should be flushed in completely. All right. Or very slightly detected by probe. You cannot have the probe stuck at the tooth restorative margin. If that is the case, you will fall into borderline or unsatisfactory. No cervical overhangs present. This is usually not the problem in the premolars or the molar. In the anterior, we see candidates having a cervical overhang here very, very frequently. Again, it's something very significant, and that makes you get a bad score or a fail in the entire category or task. And This is very easily avoidable, just making sure that your cellulose strip that you're using, it adapts to structure properly and it is the wedge is in proper place. There is no gap between the tooth strip, the margin and the cellulose strip that you use. And you can easily avoid this while you're placing the restoration. Proximal contact contour, again, the same thing with amalgam restoration, with proximal provisional crown restoration, and with the composite restoration. Proximal contact contour is neglected by the candidates. So again, try to make sure that your proximal contact contour is resembling the normal anatomical contour the tooth has. Okay. Now, just telling you about certain tasks that the candidates performed. You see the restoration is nice. Everything was fine with this restoration, except if you see this axis. All right. This is quite a lot of axis which is extending to the tooth structure, the unprepared tooth structure, which can be something that the examiner will not like and mark you down. Again, here, this candidate told us that they are very happy with the restoration they did. When we assessed it, we found certain mistakes that can be problematic. First of all, if you see axis over here. Secondly, restoration is beyond the cavity on the tooth structure. Okay, this is all axis. It should have ended here, but this is all axis. Second, if you look at the proximal contact contour, again, compromised. Okay, so the candidate thought that he did very well. But if you look carefully, if you mark yourself on the assessment of the marking rubrics, you will point out your mistakes. And having 3 mistakes, despite having done so well, will automatically lead you to a fail score. Now, I'll tell you why it leads to a fail score, because the exam is a very competitive exam, all right? If there are 100 candidates, the maximum number of candidates that are going to pass the exam is 25 to 30, all right? Which is roughly 25% to 30%, right? So the thing is that when ADC assesses your task, they need to make sure the best ones pass the exam or pass the task. And if a candidate who has done similar restoration like this candidate, but does not have these 3 mistakes, of course, that candidate is going to get a good score overall and he'll pass the cluster. But this candidate, because of these 3 mistakes, will be dragged down in this particular task and which will influence his overall cluster performance, and he might fail the restorative cluster. All right, because you have 3 tasks in preparation and 3 tasks in restoration. So if you did bad in this and you didn't perform very well in the remaining 2 tasks of restoration, which is provisional crown and so overall, this is something that will influence you. So you have to be very careful. If you perform badly in one task, you need to compensate for it by performing very well in the other 2 restoration tasks. For this candidate, it would be amalgam and the provisional crown. So if he didn't perform very well in the provisional and the amalgam restoration, and he did this way in the composite restoration, he might fail the entire restorative cluster. All right. So we'll move on to the technical OSCEs in general and see what common mistakes are made by the candidate. Now with the technical OSCEs, we are going to point out general mistakes, all right? Because we already have videos in the technical OSCEs folder with respect to each task and how you need to perform, the materials, equipment available to you, the steps that you need to take. But in general, when we did the assessment of the candidates, we found out certain general mistakes that the candidates make, which are very easy to avoid, all right? Failure to adhere to infection control measures. Now, even very good candidates, because of the stress of the exam and because of the stress of the clinical skills day, they forget to perform proper infection control measures. We see a lot of candidates even forgetting to wear the glasses, the protective glasses. Now, that's a significant mistake, right? The candidate knows that they need to wear the glasses, but because of the stress of the exam, they tend to forget about it. So make sure that you practice technical OSCEs while you're doing at home with infection control measures so that you know the routine that you need to follow. Something out of the routine, you cannot do it in the exam. And please remember, if you don't do something before the exam, if you don't follow a routine before the exam, you are never going to follow it in the exam. That's impossible, especially with all the tasks and especially with technical OSCEs. Now, the candidates sometimes tell me, yes, I know I have an undercut, but in the exam, I will not have it. It's not possible. If you have an undercut during preparation, you will have an undercut in the exam day as well. So make sure you rectify your mistake while you're preparing for the exam. And the same goes for technical osteo. While you're practicing them, try to use proper infection control measures. Remember when you enter the room what you need to do. When you finish the task, how you need to take off the PPE. And it's already there in the book. It's given to you stepwise, everything that you need to do. All right, it's about practice. Failure to examine the mannequin's mouth before performing the task. Now, candidates, when they start performing the task, any task, make sure that you examine the patient's mouth, the mannequin's mouth first, giving an impression to the examiner that, okay, I'm examining it. Now, for example, we were having this candidate for a matrix band task, and he just knew what the task was. He started assembling the matrix band and the retainer on the bracket table and then placed it in the mouth directly without prior looking at the mannequin's mouth, without prior looking at the size of the cavity. He just started preparing. Now, this is something that the examiner does not like. Just spend a seconds, like 5 seconds, examining the mannequin's mouth to look for the size of the cavity. For example, if you're doing pit and fissure, to look for the tooth that needs to be have pit and fissure sealants, the rubber dam, look at the tooth. If any tooth is missing, look for that. So just examine the tooth, the mannequin in general, for the first 5 seconds once you start the task after you're done wearing the PPE. Okay. Not utilizing the 3 minutes reading time. Again, you have 3 minutes reading time. After you are done with reading the case, look at the bracket table, what you have. Look at the mannequin's mouth generally without touching. Look at the clean area, what you have. So that once the bell rings and the performance time, which is 10 minutes, starts, you don't need to waste time doing this. Okay? Not reading the resources given, again, very important. There is a MIMS textbook, which is basically the names of the medications according to the brand names. All right. So, for example, the patient is for the local anesthetic task, you have Nardil and Endip, right? So, these are brand names. So, you need to look for it in the MIMS by turning into the E section or N section and then correlating the brand name with the chemical name. You might already know beforehand, but do this during the 3 minutes reading time to give an impression to the examiner. They have given this to you for a reason, right? So if you don't go through it, they will think that you already know this task and you have memorized everything and came for the exam. So do this during the 3 minutes that you have and read it because the MIMS is present in the local anesthetic station. All right. Failure to switch on the dental chair light. Now, again, because of the stress, we have seen candidates they even forget to switch on the light of the dental chair and they're performing the entire task. Many, many times we have seen this. And again, it's just the stress. Every candidate, every dentist who's preparing or appearing for the exam knows the dental chair light should be on while you're doing the task. But we see candidates, because of the stress, they forget certain parts of infection control procedures, or forget to turn on the light. Failure to dim the dental chair light for pit and fissure sealant. Now, the thing is that we also see candidates, they forget to dim the light, all right? Because for the pit and fissure sealant, you have to dim the light, right? While you're placing the pit and fissure, because it will get set. The light is so bright, if you don't dim it, it's going to set and you won't have any time to work on it. All right. So make sure while you're placing the pit and fissure, the light is dim. For the etchant and for the use of the prophylactic paste, that's fine. You don't need to dim the light. But for the sealant, try to dim the light. All right. And then you have inappropriate patient handling. A lot of times we see candidates, especially with the rubber dam and the local anesthesia task, their left hand, if the candidate is a right-handed, their left hand is resting on the patient's nose, forehead, eyes, cheeks. It's not acceptable. You cannot have your hand, non-working hand, resting on the patient's face, head, or anywhere. And this also holds true while you're doing the technical tasks. You cannot have your left hand or non-working hand resting on the patient's face, any part of the patient's face. Okay. Not sanitizing hands before writing incident report. Now, with the syncope case, it's a medical emergency, so you don't need to follow infection control procedures. But once you are done managing the task and they'll ask you to write a report, make sure you use the sanitizer, sanitize your hands, and then write the report. Okay, this is important infection control thing because you're touching the paper and the pen and you have touched the patient, the bracket table, and everything. So your hands are not clean. So sanitize it and then write the medical incidents report. Now, once the task is finished, each technical OSCE, the candidate fails to switch off the dental light after the task, move the bracket table away, position the patient back to normal, organize the bracket table, management of sharps with respect to matrix band, local anesthesia, and pit and fissure sealant task. Now, once you are done with the task, make sure that you switch off the dental light, move the bracket table away, position the patient back to a normal position, clear your bracket table, organize your bracket table. If there are any sharps, for example, for matrix band, you might have wedges or a matrix band. For local anesthesia, you need to dispose of the cartridge and the needle straight away. For pit and fissure sealant task, you have the tip of the etchant and the tip of the pit and fissure sealant, which needs to go into the sharp. So you will not be expected to actually throw them at the sharps container, but you have to convey to the examiner that I want to dispose of this sharp. The examiner will tell you, leave it as it is, it's fine. I have noted it down. Okay. So once you finish the task, make sure that everything is back to normal. All right. Failure to remove PPE within 10 minutes. Again, a very important thing is that candidates, they don't understand that the PPE should be removed within the 10 minutes. So each technical OSCE that you do, try to finish it within 9 minutes and 30 seconds. So the last 30 seconds, you can first do this, which is switch off the dental chair light, move the bracket table, position the patient back, organize the bracket table, sharps management, and then also remove the PP. So try to finish your technical OSCEs within 9 minutes and 30 seconds. So the last 30 seconds you have to do all this. All right. Coming to the communication OSCEs, all right. And we just discussed this. Now, with the communication OSCEs, these are the things that are mentioned in the ADC assessment, and some of them are from our side. It's very important the communication OSCEs should be dealt in a way that you're talking to a real patient, all right? So the first point is providing a rehearsed response to a standard OSCE. This is very easy for the examiner to pick up. If you're providing a rehearsed response, continuously talking, the examiner knows that you are not in the moment. So try to be in the moment and manage the patient at that particular time, rather than starting and memorizing and rehearsing everything that you have rehearsed while you're practicing the OSCEs. Okay? Seeking prompts from the simulated patient in the standard OSCE. Now, prompts are something, there are two types of prompts, all right? One is which you should have conveyed as a dentist, you should have conveyed to the patient. The other type of prompt is that the patient needs extra information. With the first kind of prompt, where the dentist should have told the patient about it, you are marked down. The second kind of prompt is something that the patient needs extra information for, and you're not marked down. All right, let's give you an example. You're managing a case of pain, right? In the management part, you forget about painkillers, and the patient tells you, doctor, are you going to give me any painkillers since I'm in a lot of pain? Now, this is a mistake because you should have, from your side, conveyed the painkillers that you needed to give to the patient, or at least told the patient that I'm going to give you a prescription of painkiller. But the examiner reminded you, which means that it's a prompt and you have been marked down. All right. The second kind of prompt, let's say the patient has missing tooth, let's say, and the patient tells you that one of my other daughter also has the same problem. Do you think it's something that runs in family? Now, this is not a prompt. This is extra information that the patient wants from you. So you give an answer to it. So it's not a prompt, all right? Or for example, the patient says that I'm using this kind of mouthwash. Is that fine for me? Again, this is not a prompt. This is an information that the patient is asking you. Prompts are something that the examiner comments or asks you. There are two types of prompts. One is related to the case, which the dentist should have conveyed. One is extra information the patient needs. for the information that you should have conveyed, but the patient reminded you, you are marked down. For extra information that the patient needs, you are not marked down. All right. Reviewing OSCE resources during examination time rather than during reading time, medical chart, periodontal chart, diet chart. Now, when you have the 3 minutes reading time, make sure that you review the cases where you have medical chart, periodontal chart, and diet chart during the 3 minutes reading time, because you don't want to waste time later on when you're talking to the patient and then going through these charts. Okay. Perform tasks as you normally would in your everyday dental practice rather than presenting what you think would look or sound better in an examination setting. Now, we also see candidates doing this mistake is that when you're dealing with the patient, you should be dealing it in a way that you would do normally as a dentist at your clinical practice. Not using statements which are complex, complicated, sounds better, and deviating you from the actual case or the actual management. So this is something that comes with practice, all right? And because this very closely relates to the first point, be in the moment. Be in the moment, manage the patient which you have at that moment, the 10 minutes that you have, all right? Wasting time asking questions with respect to information already given in the case, again, very, very common. I would say 7 out of 10 candidates we have, they do the same mistakes. When you have something already given in the case, please do not repeat it. If you've given, for example, medical conditions and everything, if the patient is medically fit and healthy, you don't need to ask, are you medically fit and healthy? Are you taking any medication? It's given, it's clear. But yes, you can ask, when was the last time you saw a doctor? That's fine. For example, the case says the patient is a smoker. Now, you don't need to ask, are you a smoker? In fact, you can ask the patient, can you please tell me more about your smoking habit? All right. So whatever is given in the case, try to not repeat it. This will do 2 things. 1, wasting your time. Second, wasting your time with respect to things that you're not getting a score for. Because repeating that information is not going to add additional score to your task, because that information ADC has already given you. Okay. Read the instructions on the scenario carefully and tailor your response to the instruction given. Now, the last line of each communication is your task for that particular station. That is what you have to do. For example, it says tell the diagnosis and management plan. That is your task. If it says take informed consent, that is your task. And that is what you're being scored on. So this is something, make sure to read it properly. It is given in a bold letters in each case in the exam on the screen. This is your task and this is what you have to do. Anything extra that you do might or might not be helpful, but this is the bare minimum that you need to do. Okay. Avoid generalized responses and be specific to the case presented. Again, when you are managing a patient, try to avoid generalized management plan. For example, you have a gum disease patient and you tell the patient, usually for gum disease patients, we do this. That is wrong. You have to manage the patient that you have today and according to their requirements. So you can help them in the best possible way. So you can tell what we are going to do to help you today is so and so and so. So generalized response, because generalized management and specific case-specific management are different. Because generalized management might have certain points which might not hold true for case-specific management. All right. Adopt a structured approach, but be prepared to modify it depending upon the situation. There is no one formula or one approach which fits all. Now, again, very important, very closely related to the previous point I discussed, that it has to be case-specific management, not generalized management. Adopt a response depending upon the answers the patient gives you, the data that is there with you in the case, and then give the patient a management plan. Avoid being overly apologetic and empathetic. Again, for candidates we see, I'm really sorry, I'm going to help you. I know it's so bad to have this pain, and so and so. 5, 6, 7 times in a case, they're apologizing, being empathetic, showing sympathy. You don't need to do that. You can do it once and twice, that's enough. Once in the start, once somewhere in the middle, that's perfectly fine. All right? Be genuinely engaged in conversation. Pre-prepared answers rarely address the scenarios accurately and affect your ability to establish rapport with the simulated patient. Again, don't memorize the cases. We have all the cases completely solved in the all solved OSCEs folder, but they are not there for you to memorize. We want you to know the script in a way that if there are any changes, you can manage it accordingly. Because when you're talking to the patient, they will give you different answers. You have to manage it accordingly. But the solved OSCEs will help you know the general pattern, the general management, the general question taking, how you need to ask questions, how you need to explain diagnosis, how you need to manage the patient. That's a general approach. It will change according to the case description given to you. And that's how you need to do. Never go with pre-prepared answers. All right. Now, of course, this is just common mistakes that we see, but there are other mistakes as well. There are other uh, commonly errors that the candidates make. We have discussed all of that in the portal. We have the technical OSCEs, technical task assessment videos, communication OSCE solved ones to give you an idea how you need to perform in each task. All right. Well, that's fine. Thank you for today.